The main differences between the total deviation and the pattern deviation, it's basically somehow a similar to MD and PSD. But the difference is that MD and PSD is a global indexes, and the total and pattern deviation are for point-wise analysis, right? So on the total deviation, what we're going to do, it's what going to basically determine the global height of that patient's field of vision, right? So we're going to define whether there is a depression or not. That will be the total deviation. Then what the pattern deviation does is taking as a baseline that deviation, then it starts subtracting the deviation from each individual one. And that is how we can define whether the defect is sectorial or not, right? If you have a global depression because of cataract, let's say, then very likely your total deviation will be, let's say, dark to call it somehow, right? With mostly, let's say, with the symbol of 0.5% or less than 0.5%, right? So dark spot. But on the pattern deviation, it will be completely normal, right? Why? Because the pattern deviation is only looking for sectorial isolated defects rather than the global indexes. But if you have glaucoma, then few things might happen. It could be that if, let's say, you have glaucoma but you don't have cataract, then very likely your total deviation will be sectorally defect. And on the pattern deviation, that sectoral deviation will remain, right? And basically what it does, it confirms that we have a sectorial defect. If you have a patient with glaucoma and cataract, what you might see is that the total deviation is totally dark. And in this plot, we cannot see very well or define whether it's glaucoma. But then when you see the pattern deviation, you see that most of that global or what is not a sectorial defect will turns into maybe normal, let's say, probabilistic symbols, and only the area affected by the disease or the condition, let's say in this case glaucoma, is the one that remains with the abnormal probability results. So how this is how you can use the visual field to differentiate between these two and to evaluate these patients, especially if they have neuro retinal diseases.